All right. There you go, Jim.
Come in.
Hi.
Hello.
My name is Jennifer Serna. I'm with Echo Smith & Klein. How are you today?
Doing good, how are you?
Good. Do you mind if I take a seat?
Of course.
Great, thank you. Do you mind if I use your desk real quick?
Of course.
Thank you. How's your day been so far?
Doing pretty good.
Good? That's
Yeah.
great. This weather's amazing.
I know, right?
I love it.
So, Florida in the fall is just great.
It's the best. Alright. So, I just wanted to say that I have an older sister who used to smoke all the time.
Mm-hmm.
And she started when she was young. And she tried to quit for the longest time by herself, and it didn't really help her or worked out. So she went to a clinic like yours, and with an aid, it helped her completely stop. So I have the highest respect for what you do here.
Well, thank you. That's awesome.
Yeah, and so which is why I'm trying to help other clinics like yours be able to help her stop smoking, or people like her stop smoking.
Okay, yeah, we're really proud of what we do here, and we love to hear stories like that. You know,
Yeah.
I was actually just contacted by a local newspaper, the local national cable television the other week, and they're actually coming to do a whole camera crew interview on me and this whole special long story.
Wow.
So I'm super excited about that, and I love to hear stories like
Congratulations.
Yeah,
That
thank
sounds so exciting. All right. So, do you mind if I take notes?
Yeah, go ahead.
How long do you this? Okay, perfect. So, today I'm going to ask you a series of questions to get to know your clinic a little bit better and see how Nicorette can fill your needs. And then I'll give you a brief presentation about GSK's Nicorette gum, so you can get a good idea of who we are and what we can do.
Sounds good. Yeah, sounds good.
Awesome. So before we begin, I need to make sure that you're the one who usually takes care of the decisions, or does someone else need to be here?
No, it's just me. I mean, I obviously like to talk about things with some of my representatives, but I mean, I'm always allowed to make decisions too.
Great, perfect. Okay, so do you mind if I start asking those questions now?
Go ahead.
All right, so what is the demographic build of your clients?
You know, it really varies every month. I can't give a specific. I mean, we generally, obviously, I would say between, probably over 20s, and it's probably half male, female, so it's nothing specific.
Got it, okay.
That smokers is probably a great demographic.
Got it, okay. So, what are your programs usually personalized, or they're more like a one-size-fits-all?
They're definitely more personalized, being geared towards the person individually. So, we kind of see what their needs are, and we go from there.
Great. So on average, how long do your patients take in the 12-step program?
I can't tell you exactly how long they've taken, but I can tell you that we have a success rate of 60%. So it really it takes what it takes, and however long it takes to get there. Some people are 10 weeks, some people might be 4 months, 5 months. It really depends on the person. That's where the personalization comes in.
So what are you currently recommending as an aid for your program?
We are currently not recommending any specific aid, but we do use our group therapy, the high success rate. That's the one that's 60%.
Got it. Okay.
Yeah.
And so you say it's 60% right now, and where do you want to be in a couple of years?
100%, right?
100%, absolutely. Just want to make sure.
Mm-hmm.
So do any of your patients relapse?
It does happen, but we find, so when I say success rate, I mean that they're the ones who are continuing to stay, to not relapse. So they're just like 40% relapsing, or relapsing or not quitting in the first place.
Got it. Okay. So what happens when they do relapse?
Well, obviously at first they start smoking again, and then they eventually come back in, and we start the program again if they choose to reuse us, obviously.
Right. So how does that impact your success rate? I know you said it's 40%, but does it have a bigger effect on that than just the 40%?
What do you mean?
Is there anything else that might impact the success rate besides like when they come back? Like, does that 60% drop, or does it?
I mean, if they're coming back and they are successful, I guess that'd make it go up, right?
True. All right, and so does the clinic lose credibility when the patients are dropping out of the programs or returning to the program?
I wouldn't say so. I mean, that kind of speaks for how well we help the patients that they would even want to come back in the first place, right? And I'm really proud of the programs that we have right now. We feature in local newspapers, and then this whole kind of cable television thing I'm really excited for. We're doing a special story on lung cancer, and I think it's going to be great for us and the public image of our clinic and everything.
Sure, absolutely. All right, so what if I could show you an aid that would complement and increase the success rate of your program? Would you be interested?
Yeah, it sounds like something I'd be interested in.
Great. All right. So just want to let you know a little bit about GlaxoSmithKline, or GSK.
Okay.
It's the world's second largest pharmaceutical firm. It markets to more than 50 major prescription products across 9 major therapeutic classifications, with a worldwide sales volume of over $40 billion. Right?
Yeah.
GSK is committed to aggressively continue as a major supplier and distributor in industries and markets it competes in. And with an annual research budget of $5 billion, it continues to develop, create, and manufacture and market new pharmaceutical products and over-the-counter drug products.
Mm-hmm.
So for today, we're talking about Nicorette Stop Smoking, a chewing gum,
Okay.
which is an over-the-counter product sold by GSK.
Mm-hmm.
It's one of the top 10 over-the-counter brands in the world. This means it adds credibility to the brand, and a real benefit is that your patients will be less likely to be hesitant to try it.
Okay.
How does that sound?
Yeah, that sounds good. And is there any guarantee that this Nicorette gum really works, though?
I'm actually going to talk about that later. Do you mind if we
That's
explain a little bit?
well later.
All right. So Nicorette gum comes in 4 sugarless flavors. It comes in original, orange, mint, and fresh mint. This allows patients to have variety and options. The benefit is it's likely to be more appealing to more people trying to quit. Would you agree?
Yeah.
Okay. All right. So Nicorette gum comes in 2 strengths. The 2 milligrams for those who smoke 24 cigarettes a day or less, and the 4 milligrams for people who smoke, or 24 cigarettes a day or more.
Okay.
This means it could help both the light and heavy smokers, and it could benefit them at any stage in the road to recovery. That's something important to you, correct?
Yeah, that's definitely important to me.
Right. So both packages bring 108 pieces in the box, which is long enough for a full 12-week treatment period.
Okay.
The 2 milligram strength has an average retail price of about $45 per box,
Okay.
and then the 4 milligrams has an average retail price of about $55 per month.
Okay.
This means your patients will pay significantly less than smoking. With the real benefit is that they will save approximately $2,000 a year once they quit. How does that sound?
This money thing is great, but I'm really concerned more about safety. Like, how do I know that this product is safe?
Well, we have different, like I said, studies, and because we are such a big firm, we have different studies that show the safety and all the different regulations that we comply with.
Mm-hmm.
If you'd like, that's something I can send you later in an email, all the different safety studies that we have and everything like that.
I definitely would like that, but I guess it's bigger for me, so I understand you all this safety stuff, or all these regulations that you pass, but like, what if you find out later that it's not safe? Like, what happens then?
We definitely have research that helps with all that, the side effects that may come up, and which in the study it kind of shows.
Mm-hmm.
So we have also different ways to be able to help that.
Okay.
We could also send you all that information as well.
Yeah, I mean, that would be great. I think I'd love to look that over.
Perfect.
Mm-hmm.
All right, so Nicorette helps patients control cravings in 2 ways. The gum can be used on a regular schedule to help prevent cravings throughout the day, or it can be chewed on impulse to help relieve an unexpected cigarette craving.
Mm-hmm.
This means it will help your patients at any moment of the day, and the benefit is they can use it the way they need.
Mm-hmm.
Like you said, it's something personal. You personalize these, so this can be personalized to them as well.
Okay.
So it helps the patient withdraw from nicotine through a gradual decrease in dosage until the gum is no longer needed. And often at the end of the 12-week period, the patient can be nicotine-free.
Okay.
Is that something that sounds appealing to you?
What happens if the patient chews more pieces of gum than instructed? Like, would they get sick, poisoned? I mean, could they die?
Our studies have shown that you need to have such a huge amount in such a short amount of period to actually have a huge impact on the person. So really the answer would be no.
I think that's all I need to hear. I mean, if the answer is no, I'm sure people are addicted to nicotine. They might chew 2 pieces if they have to.
But that won't harm them in any physical way.
Okay, glad to hear that.
Okay. All right, so, but I was going to say that most people are concerned with the ingredients being nicotine, but they realize the gum is a much healthier alternative to actually smoking, and people prefer it when trying to quit. Would you agree?
Yeah, definitely. I think so.
All right, so these are testimonials straight from our website about success stories. I know you said you really like to hear different ones, so I have a whole bunch of lists of of them.
Mhm.
And as you can see, we have a high success rate of helping people achieve their goals of becoming non-smokers within the near future.
Mhm.
There are no guarantees for the product's effectiveness, but as you can see, it's helped so many people thus far be able to do what they thought was impossible. Since we are a successful and well-established company, we have tons of similar testimonials and reviews about Nicorette,
Mhm.
and this is a benefit to you because studies show that people trust peer review or peer recommendations more than professional reviews and traditional media. Would you agree?
Yeah, definitely.
All right, so as you mentioned before, you hope that your clinic will be at 100% success rate.
Mhm.
With a counseling program like yours, Nicorette increases a patient's chances of successfully quitting by 2 times. So this means it increases your success rate and gets you closer to your 100% goal. And this also benefits you because you have a higher success rate for your clinic, and your clinic looks reputable and effective.
Mhm.
That's something you would like, correct?
Oh, yeah, definitely want
Mm-hmm.
all that.
And we also have some other notable features, such as the child-proof packaging with the 12-week treatment supply, the innovative formula to minimize stickiness, and included instructions to help improve the chances of successfully quitting.
Okay. Yeah, I hate when gum like it really sticks in your mouth.
I know, yeah. That's the great thing about it. Like, the formula is to minimize stickiness, so that means patients with, let's say, crowns or false teeth,
Mhm.
it doesn't stick to their dentures.
It's great because we have a lot of older patients, so I mean it really helps them out as well.
Right. So, like I was saying, the benefit is that long-time smokers with these problems are able to chew the gum comfortably.
Mhm.
Is there anything else in specific you'd like to go over or know more about?
Well, so now you talked a little about how you couldn't guarantee anything, basically. So I mean, like, you just can't guarantee anything that it works, or like, do you have like some sort of success rate that you have that you could tell me about more?
Can I ask you to clarify that?
So I want you to talk about you couldn't guarantee the successfulness of it. But do you have like a success rate that you like internally that you know that you could tell us about? Maybe how much it's helped people you also go through counseling.
Right. It's we have a good 65% success rate thus far.
Okay.
So like I said, there's no guarantees, but almost nothing is guaranteed to begin with.
Mm-hmm.
So, but as you can see, we rather go based on proof rather than just numbers, and to show you that it is successful, and a lot of the people have greater success at quitting, especially with the counseling program, just as your own.
Definitely. I know quitting cold turkey is not easy. So.
Not at all.
Yeah. I need you to tell me the truth, okay? What are the bad side effects?
Well, for a while it didn't taste very well, and a lot of our users did complain about that. But like I said, with our large research and development budget, we were able to help that taste.
Okay.
And so a lot of people actually like it now, and we even have someone who says that they chew it just for the fun of it, and of course we told them not very recommended.
Right.
But we improved the flavor, and we listen to our users and our patients, customers, and try to make it as best as possible for them to help.
Yeah, I'll try this. Okay, all right. Yeah, I mean, that sounds good. That's one bad side effect.
Okay.
So, you know, I like the product. What do you think about returning next week? Because I really want to see how the community responds to my cable television coverage.
Sure, absolutely. But I could also leave you with this sample right here. You can try it out on a patient or a small group and see how they compare to the rest of them with your counseling program, and that way you can kind of see how you feel about it. And I could follow up with you in a few weeks and see what you think.
I mean, I'm okay with you coming back next week and maybe trying this out, but I need you to watch the cable show and provide an opinion.
Absolutely.
On the story's image for the clinic.
Yeah, absolutely. Yeah, so I will leave this with you, and I also have this card, my business card, if you have any questions or concerns.
Okay.
So when does the cable come out?
So it's going to be on air tomorrow.
Okay.
So this week, let's meet next Monday.
Next Monday, perfect, sounds good.
Okay.
All right, thank you so much for meeting me.
Mm-hmm.
Have a good